News Channel 5 network, this is MorningLine with Nick Barris.
Good morning, everyone. Thanks for joining us on MorningLine. Nick Barris here. We have a good show on tap for you this morning. I'm going to invite you to join in the conversation on this Wednesday. It's something that we cover in our news business all too often, and it's a subject that I've followed over the past several years. And I think the pressures that young people face these days in society are greater than ever before. Okay, there's more opportunity out there, more resources in a lot of ways, but at the same time, pressure, and then we hear about anxieties, and we've sadly done stories of teen suicides. And that's what we're going to discuss this morning. I think we could do a show on this every month, frankly, just to raise awareness. And it's not just about the problem, but also I think this morning we can talk about some of the help that is out there, the resources that are available, and that there's always hope in these cases, no matter how low in despair you're at. And I know suicide and depression and all that is not just any specific age, but we're going to be focusing more on young people this morning. We'll open up the phone lines if you want to join in the conversation. 737-7587 is the number. We have two guests with us from over at Vanderbilt. Dr. Greg Plemons is with us. He is Associate Professor of Clinical Pediatrics at Vanderbilt School of Medicine. Good morning to you, sir. Thanks for coming on. You brought a friend with you. Dr. Heather Kreth is with you as well. And you work with him, and I'll explain how you two kind of coexist. And as I said, we'll open up the phone lines if you want to jump in as well, but maybe we'll start with you, Dr. Plemons. All right, so you are a pediatrician?
I'm a pediatrician.
Okay, and now, I think back with my time with pediatricians, running out of the doctor's office when I was going to get a shot or something like this. But as a pediatrician, you also deal with the mental as well as physical aspect of these youngsters?
Right. General pediatricians are trained to deal with a lot of the aspects of children, everything from development to asthma to immunizations to mental health. And increasingly, mental health is becoming a big issue for kids. I primarily work in the hospital setting. But colleagues of mine also work in the outpatient setting as well. So we're seeing these kids every day, whether they're coming to the hospital following an overdose or coming in for a measles booster.
And sometimes someone could come in for a measles booster, but you pick up on the fact when you're with them that they are dealing with other issues as well?
Absolutely. Yeah.
Okay, and is that where Dr. Kreth sometimes comes in to help? So you are a social worker?
I'm a psychologist.
Psychologist,
yep.
Okay.
So I'm a child and adolescent psychologist, and I work at the Children's Hospital.
Okay.
And my role is to help oversee the care with my pediatric colleagues of children who are in need of intensive psychiatric treatment but are unable to locate that treatment from an emergency room, for example, and so they get admitted to our Children's Hospital at Vanderbilt to wait until there is an appropriate bed. Unfortunately, there's a significant resource problem in the state of Tennessee for available inpatient psychiatric beds for children and adolescents. And so what often happens is they end up having to wait in a medical setting until they can get to an appropriate psychiatric setting. And so when they're in the medical setting, I take care of them.
So that's where you're kind of waiting until a bed opens up. And if you would, like, where are these psychiatric beds?
Yeah.
I mean, what kind of facilities are there? Are they connected with the university or the hospital, or are these separate facilities?
So both.
Okay.
So Vanderbilt has a psychiatric hospital. It is there's a specific unit for children and adolescents. So in order for a psychiatric facility to be licensed to see children and adolescents, they have to meet certain criteria around their staffing and things like that. So there's separate units for children and adolescents. We have one at Vanderbilt. It is fairly small. There are other area hospitals. There's one in Franklin and Murfreesboro and Madison, and then you kind of move farther out. Unfortunately, if you have a child who's under the age of 13 who needs emergency psychiatric care or inpatient psychiatric care in the state, the next closest facility from Vanderbilt is an hour and 15 minutes away. So if your child who's under the age of 13 needs to be hospitalized, you are likely looking at having your child go pretty far away from home in order to get that care, which is obviously disheartening and very anxiety-provoking for families.
Oh yeah, and whether they can get there or not,
and whether they can get there or not,
they have.
Exactly.
All right, if you could, for the viewers as well, maybe you both can weigh in and give me a couple of examples of cases, obviously anonymous, and I know HIPAA laws, but to understand what the condition of a child has to be admitted into something like this. What kind of symptoms? Talk about a case. Again, no names, of course, but give us an example of how bad it has to be admitted.
The most straightforward way that kids get to us obviously are kids that have seriously attempted to kill themselves.
Okay.
So whether that's an overdose or cutting or hanging, those kids end up in a medical facility, obviously, and need urgent care. There's also a second population that has disclosed that they are thinking of harming themselves, and we really want to keep those kids safe. So there's a couple of different ways that people come to us, and we rely on our psychologists and psychiatrists to kind of make that assessment. How safe is this kid? Can this kid be safely discharged with good follow-up? Does this kid need to be admitted to the hospital?
Okay, yeah, that's the most extreme, and I guess catching it sometimes, well, I guess, you hear sometimes when folks talk about maybe killing themselves, if they're talking about it, then maybe they're hoping someone helps them.
Right. So it's really important to note that there is absolutely zero research to support the myth that when you ask someone about suicide, you are going to make them think about suicide or make them do something. So what we know actually is we reduce suicide risk by screening people for suicide, asking them if they've been thinking about it.
Sure.
We do know from lots of really great data, and you can find this on the CDC's website, that about 1 in 5 kids at any given point are thinking about killing themselves, have thought about killing themselves.
And when you say thinking about, is it kind of like it crosses their mind, they've heard of suicide, or, I mean, people think about crazy things, and it's not really anything serious, or that they genuinely thought, I feel so horrible right now, I want to end this? Yeah,
so the 1 in 5 statistic is really kind of, have you thought about suicide within the last year? It's a specific survey that's
like how you're going to do it, why, where you're going to do it, things like that, specifics.
So greater than 1 in 10 have made a serious plan. So it's about 1 in 5 who have thought about suicide in what we would call a passive way, and then it's greater than 1 in 10 who have seriously considered suicide, started to think about a plan, things like that. And so I think it's really important to highlight, though, that asking people and screening for suicide risk is very protective for suicide. So it helps us to reduce suicide.
I'm really glad you said that.
So
don't be afraid then to address it.
Do not be afraid to address it. We need to be screening people. But that's a myth that people that often gets perpetuated. If I ask, I'm going to make somebody think about it. And that's just not true.
I have a friend who has a young daughter that is in high school that's going through some issues and has anxiety, and I think it's been diagnosed. We all feel anxieties in high school, and I don't want to get into how you know if someone really has a problem, or if, look, hey, that's life, you're going to have to deal with it, I mean, but she mentioned maybe hurting herself at one point. Never attempted anything, but maybe one of those 5, 1 in 5, and he and his wife were, kind of just wondering, how it definitely got their attention. And I would imagine you would say, if someone says this, you always take that seriously. And so I think they addressed it with her, like you said.
Yeah, so I mean, what's most important is that if you have a concern, if your child is coming to you and saying, I'm thinking about hurting myself, or I'm thinking about killing myself, licensed mental health providers and even pediatricians who have received training, or other kind of general pediatrics people, we do sort of evidence-based assessments and kind of figure out levels of risk. There are lots of ways that you can modify and address risk levels for someone to commit suicide, and can really get people help. So I would say, if you have a concern about your child, or if you know someone and you've got a concern, really getting them to the appropriate mental health professional who is trained to kind of parse through, is this something that's more of a passive thought that we can provide a lot of supports for, and this person will be okay? Is this something that's more serious and we need to do more targeted treatment for the suicidality? You can treat suicidality. There are evidence-based strategies for working with people who are suicidal.
No question that you can. So that's really what I hope, if anything takes away from this show, and we've got until 9 o'clock, is that there's help out there, and we're going to get more into that, and more of understanding behind it, and some of the pressures out there on the kids these days too. The number is 737-7587. We have a couple calls coming through. If you stay on hold, we'll get to you. We've got to take a break. We'll be back with more right after this.